patient needs to be moved through tight quarters where the canvas of walls is not necessarily an optimal option, the other option you have is the stair chair, which is located in the back corner of the passenger side of our ambulance. It's going to be located in this lower portion, and it's just pulled out. Be aware that it is about 40 pounds, so you don't hurt yourself grabbing it. To deploy it, you're going to take the handle at the top, and then you're going to grab the other half. You're just going to pull them apart, and then it folds into a chair. Make sure that it clicks into place, otherwise it won't lock and it could potentially collapse on the patient. The stair chair has two straps, which will go crisscross over the patient, across the patient's chest. Make sure that the green strap meets with the green strap, and then the black, two halves of the black strap mate with each other. Those will go crisscross across the patient's chest, and they should be snug but not too tight, just like a longboard strap. Sometimes there's also a strap around the ankles, but it's not all of our stair chairs have it. That would go around the patient's feet. It's imperative if the paramedics haven't, to instruct the patient not to grab for walls or anything and just let us do all the work, even though it may be quite an odd feeling. When you're going downstairs, we have the track device, which assists in descending stairs at a more controlled weight and taking a lot of the workload off of the providers. That is used in conjunction with this bar, which is extended by pulling on this red cable, and that will allow you to pull this up until it gets to the top. Or it also has two other settings besides this setting. That will allow the care provider to bring it to the cusp of the stairs, lean it back, and then let the tracks ride down the ends of the stair treads. To retract the stair treads, as with all Stryker products, if you have something that's marked with a red, that means that it's something that actuates or moves. So in order to collapse these chairs, you're going to grab this red bar that's down here. You're going to pull it up towards this black bar above it, and then that'll allow these to move forward and snap back into place. You can also pull back on this red strap, or this red cable, and that will allow the upper railing to come all the way down. If you're going to be taking the patient upstairs, it's important to remember that you do not use the tracks to go upstairs. They're only for going downstairs. At that point, it's important to just use these two handles, which will actuate up, and then they can be held by a provider on each end. There's also these two handles on the bottom, which also have a red marked portion. That means you press that, and you can pull these out, and these extend to give you a little bit more reach, so you can get past the patient's feet. All right, after the patient's been removed from the stair chair and put onto the ambulance stretcher, it's important to ready the device for service again. So you're going to mate the ends of the buckles with each other and make sure that the straps are pulled out so there's a little bit of slack on the end, which makes it easier to put away, and it helps care for our devices in the long run. And then to pull the stair chair back up, you're going to find this red bar. It'll be the lowest red bar on the stair chair. You're going to pull it up towards you, and that will allow the chair portion to collapse. It's helpful to lean a little bit forward so that these wheels that are on casters are able to hang down. That makes folding it back into place a little bit easier. You bring it all the way up, and then you'll see that there's these red catch hooks. You're just going to push it all the way into place, and you're ready to put right back into the ambulance side compartment where it was taken from.